Morning. Good morning, online students.
Good morning, ma'am. Good
Umesha,
morning. Good morning, ma'am.
do you know about Riska? What happened to Riska?
Don't know, ma'am.
She's not attending online classes, yeah?
Yeah, ma'am.
See, I'll tell you all to maintain a file. Okay. No, that's it. What? Ah, yeah. Oh. Oh, okay. So, designing, monitoring, and evaluating health and nutrition programs. So, what is known as like nutrition? What is nutrition? Child's healthy. What are the 6 essential nutrients? No, lipid don't count. Not. Okay. So when it comes to carbohydrates, it supports what? Supports for the body growth or for the muscle growth or for the brain development. Why are you telling like muscle growth? So can you tell me some examples of carbohydrate and bread? So it supports to your muscle growth. Bread supports to your muscle growth. Meat, okay. Meat, carbohydrate. Milk. Okay, so what are like proteins and what supports? Proteins, milk, meat, cheese, butter. Cheese, butter, dairy products, of course, we can see. Apart from that, vegetables, proteins. Fruits. What kind of fruits? There are some variety of fruits. Well, students, you also can answer. Uh, um, now okay? Amina? Umesha, I all can hear me? Or is it breaking?
Can't hear properly, ma'am.
Can't hear properly. Is it a Wi-Fi problem?
Vibrate.
Now can you hear me?
Now also same, ma'am.
Yeah, it's connected. I don't know why. Earthquake. So what about the facts? Facts. Facts. Healthy facts. Yeah, yeah, right. Fats itself is fats. Egg, no. Egg is protein. Minerals? Cereals. Yeah, that's oil. Yeah, okay. And so, what is hydration? What is dehydration? Symptoms of dehydration? Dizziness, tired. How can you say dehydrated for dehydration symptoms? So, okay, thirsty, faintish, huh? Low energy. Okay. And dizzy and huh? Headache. Lethargy in the sense like dizzy. Okay. So, do you have any idea about that nutrition programs? What is a nutrition program? Do you have any idea? So, what are those nutrition programs? Tomorrow you all have English classes, right? Yeah, she is alone. Or else you also come around like 12, 1, like that. No, if you are not interested, it's your money. It's your like your thing to come and because this campus want like so okay. Huh? I don't know. Huh? Ah, yeah, yeah. No, no, no. Yeah, with me only. So, okay, okay, sure. So, our learning objectives will be explain the purpose of health and nutrition programs, identify the key components of effective programs, conduct a basic needs assessment, develop smart goals and objectives, describe methods of monitoring and evaluation, use feedback to improve health and nutrition programs. So introduction to health and nutrition programs. Health and nutrition programs are organized plans designed to improve people's health, prevent diseases, promote healthy lifestyle, and improve nutritional status. These programs may be implemented in school, childcare centers, communities, hospitals, and public health organizations. So by like implementing health and nutrition programs, we can, or like people can be able to know about their health, how their health is like maintained, whether they are having like diabetes, pressure, cholesterol. Do you know like in village side they will keep like medical clinic like once a year. Don't you know? Yes, yeah, they used to keep. Not in like city areas, in those like village kinds of areas, they used to like once a year. Yeah, yeah. Once a year, they used to keep like nutritional programs, those health programs. So from that, it's basically for old age people. So they basically know where they like having sugar or like pressure or like what kind of the blood group they have. They used to check all of those from health programs, right? So when it comes to school, we often keep nutrition programs like to teach about nutrition, like what are the foods you have to take for the students, right? So for childcare centers, of course, for toddlers and preschoolers, you can keep nutrition programs like have you ever heard about those autism programs, autism awareness programs? So they used to keep those autism awareness programs to teach what is autism, because half of mothers doesn't know about like what is autism and what is the symptoms of autism, whether the symptoms of the autisms have on the child as well, right? So teach those about like autism, ADHD, those kinds of child mental disorders. Child mental disorders, they used to keep those programs. So as well as we can also keep like nutritional programs, like what are the kinds of food your child must take, and what is the breakfast, what is the lunch, what is the dinner, in the evening what you have to give like snacks, and from those nutrition programs, this all you can share with your like the teams of mothers, right? So when it comes to communities, community programs in the sense those like if they are having like those community programs, like for example, what is it? Do you know about the Red Cross Society? The Red Cross Society in like near the town hall, Red Cross Society. Don't you know? Red Cross. Wait, Ash. How to open a new tab? Is it here? This is known as Sri Lankan Red Cross. So they usually do like first aid courses. This. So in here there are like programs. They have like programs like this, first aid training programs and disaster and climate resilience. Disaster and climate resilience in the sense that is a like volunteer program, right? So when this Diploma came, they came on one group and they help people. So that is a kind of a program, right? So and health and care like implementing them about dengue and the illness that will come up with the flood, like the influenza and all. So those are some kind of programs that they offer. This is the Red Cross Society. It is basically like volunteer programs. Yeah, these kinds of. This is when they help the poor people. This is about like first aid. Yeah. Now we all know what is Red Cross Society. Like there are many actually. There is IRT, IRT Center in Ragam. Do you know IRT? That is a hospital for children, mental hospital for children. Actually, they take volunteers as well. That is more of a like IDH. IDH. That's for like yeah, adults, 18 plus. For small children, lady Ridgeway, there is a specific psychiatric unit for that. Yeah. Yeah, you can admit. As I know, I work there. No? So it's on the sixth floor. Sixth floor is a psychiatric ward. Children's yeah. Admitted. Huh? No, no, not like that. Most probably children won't like do like that. If they will tie up and like they will put some injections to sleep. Like those kinds of things. Yeah, we can. Uh, we'll go on one day actually. Maharagam. No, actually you want permission, I guess. Yeah, it's a hospital. Yeah, I didn't know So if you want to go like those, if you want to visit, I can talk to them actually. For like Lady Ridgeway, okay, I'll talk to them. How can I? So, what is a health and nutrition program? A health and nutrition program in early childhood education is a structured curriculum and operational framework that integrates physical well-being, safety, and healthy eating into a child's daily routine. It ensures that children receive proper nourishment while building foundational lifelong habits. So, health and nutrition programs in ECC is known as we are teaching them about the nutrition, about the physical health of them, and the safety, about the safety, right? So here my children, my other children. Yeah, they are in America. No, I bring them, they're like unfortunately they're in it. Importance of health and nutrition programs. So benefits: improve health, prevent diseases, promote promote healthy lifestyles, reduce malnutrition, and improve quality of life. So do you know what is malnutrition? Do you know what is malnutrition?
Poor nutrition. Is it poor nutrition, ma'am?
Poor nutrition, yeah. Huh? The micronutrients and macronutrients. Yeah, that's like that. So no, malnutrition is of course like obesity and malnutrition. Obesity, childhood obesity, yeah, overweight. Wait, I'll show like childhood obesity. Who? Yeah, Africa. Other kid. No, right? So this is childhood obesity. Like this is my sister in the child. So malnutrition is this. Like this. This they're basically on Africa, Brazil, those kinds of places. No nutrition. They doesn't have the nutrition. They don't have food actually. Like we are getting 4 meals per day, but for them they are only getting 1 meal per day. For that 1 meal also sometimes it's not sure. That's why they are like this. See here. Because of the nutrition. So, yeah. No, haven't they taught in science or whatever? Yeah. Yeah. How many in the sense 10, 11, 12? So for child, this could be like very small for them. So it getting better when you are like growing taller, like fat, like that. Yeah. Huh? No, right? No, I don't think. This one. I don't think actually. I also can't remember about this ribs, but 24. No, here this count applies equal to both men and women. Yeah. 24 ribs. Here, baby strip. Baby strip. They also have the exact same as a person. Like here, a human baby has 24 ribs. 12 pairs. 12 pairs in the sense 12 pairs one side and 12 pairs on the side. Now, okay? Do you want to go or I want to? So can characteristics of effective programs. An effective program should be evidence-based, practical, inclusive, sustainable, measurable, culturally appropriate. Essential components. Nutrition, meals and snacks. Providing daily menus that meet dietary guidelines. For example, integrating whole grains, protein, fruits and vegetables to fuel physical growth and sustain classroom concentrations. Nutrition education. Using sensory play, gardening, such as farm to easy eat initiatives, and interactive activities to help young children understand and develop a positive relationship with healthy foods. Health and hygiene practices, teaching daily routines like proper hand washing, toothbrushing, and personal sanitation to protect children from germs and disease. Physical activity, incorporate play, active outdoor learning, and limited screen time to build motor skills and healthy cardiovascular habits. Family engagement, educating caregivers on child feeding practices and nutritional needs to ensure a consistent approach to wellness between school and home. So these are some essential components that you have to include in your, if you are doing a health and nutrition program. Right? These are some essential components. So when it comes to like nutritional meals and snacks, you have to keep like daily menus. Right? So this is good if you take this for breakfast. This food is good if you take it for lunch. This is good if you give this to your baby to dinner. Like those kinds of things. Right? So nutritional education in the sense you can educate people about nutrition and you can educate people about the child's physical health, about the safety, about what will be the diseases by getting about the low nutrition. Like you can educate them. I mean, the mothers and fathers. So health and hygiene practices, of course, you have to like, in a nutrition programs, you have to include all of these, right? So you have to teach about like health and hygiene practices as well, right? Like proper hand washing and proper like daily cleaning yourself, your babies, right? Physical activity and family engagement. So family engagement in the sense how the mother and father is interacting with the baby. You have to educate that also. If you are doing a nutritional program, right? A needs assessment. Okay. A need assessment in early childhood education. Yeah, we can say that. A need assessment in early childhood education is a systematic process of identifying gaps between a child's current development and educational levels and the expected standards. Its purpose is to figure out exactly what specialized support, resources, or instruction a child needs to thrive. Right? So in here, first one is the gather evidence. Gather your evidence in the sense what kind of evidence? What kind of evidence in needs assessments? So you can ask by their mom, like what are the kinds of food they are taking for breakfast, for lunch, and for dinner, right? So that is known as the evidence you are taking, right? And the second one is analyze evidence. Analyze evidence in the sense you have to analyze it whether they are giving the proper nutrition for the proper breakfast, lunch, or dinner, right? So that is known as like analyze evidence. Brainstorm contributing factors. So this is what, in the sense, you have to teach, you have to educate about nutrition. Like if it's wrong, if the For an example, if a child is taking the raw nutrition for the breakfast, you have to educate, you have to brainstorm them, right? So that is the third step. And the fourth step is a get a root cause. Get a root cause in the sense it's the same one, you have to educate, right? So determine next steps for improvement. So you have to tell them like this is not good for them. You have to give this for lunch and dinner and for the breakfast and for the snacks as well. This is the correct procedure to maintain for the improvement. Right? Analyze evidence. Analyze evidence in the sense if like you have to analyze it whether they are taking the proper nutrition for the proper breakfast, lunch, dinner. Why? What happened? You are holding down the central. So why conduct a need assessments? It helps to understand community needs, prioritize problems, allocate resources, and design relevant programs. So what is known as a need assessment? So methods of need assessment. For an example, surveys, interviews, focus groups, observation, health records, or community meetings. So these are some examples that you can take. Surveys in the sense, those like questionnaires, how to say that? Like, yeah, those like Google forms and questionnaires. So interviews, focus groups, observation, health records, and community meetings. So if you want to like keep a need assessments in a childcare centers or anywhere else, you can keep like any methods of this, like whether you are like taking from a survey or from an interview, you can interview the mother, father, the child, right? You can take information from that, or else you can observe them, or else you can take it up to a community meeting. Identifying a target population. So, for an example, infants, preschool children, adolescents, pregnant women, older adults. So, if you ever want to do a need assessment, you can identify a target population from these followings, right? Infants, in the sense, you can take their mother, father, and the infant, right? So preschool children, in the sense, has same as the mother, father, preschool. So adolescents, in the sense, you can interview only the one group, only the one adolescent. You don't need to take the mother, father, or anyone. Only the adolescents. If there's a boy, only that boy, right? So when you're if you would like to take a pregnant woman, you can also talk to his husband as well. Sorry, her husband as well, right? So all the adults as well as you can talk to their daughter, son, to gather more information if you need. Understanding community needs. Consider age, culture, income, education, health conditions, access to health care. So if you are, for an example, if you are doing an interview, you can consider these following areas, right? You can ask the age, you can ask the religion, you can ask how the income. So for a pregnant woman and all age people, you can ask like what is the income, right? If they are able to share with you, that's okay. If they are not able to, they are not comfortable to share with you, then don't go and ask, right? So what is the education and health conditions they have and access to healthcare as well, right? So these are some of the, if you are doing like a questionnaire as well, you can include this. Setting smart goals. So do you know what smart goals in commerce? So yeah, in commerce, business studies, as I remember, smart goals. Why I love business studies? Balance board forward. Cash book. Petty cash. Reimbursements. Double entry. Debit credit. Those are easy actually. So apart from like degree level thing, those are very, very easy. Now if I think back about my orders, this is very, very easy. You have to be in that situation where you can understand it's very, very easy. So setting smart goals. Smart means specific, measurable, achievable, relevant, and time bound. Right? So it's like this. Smart. Smart. Can you see? Yeah. So what is smart? S. Definitely. What is then? A. Zero. R. Zero. This is like smart. So can you tell me an example for being specific? Being specific. Particular teacher. So, here, specific person. Specific person, yeah, that's it. So specific is clearly identify the exact skill or behavior you want to target. For an example, a child will recognize and name primary colors instead of learning colors. So you are like exactly identifying the specific skill, like targeting the specific skill or the behavior. Measurable is establish how you will track progress and evaluate success. So tracking how many times a child stares a toy during playtime. So measurable in the sense you know about measurable. What is measurable? So if you are like so we can say, so for an example, you have an exam like next week. So you will be counting from today, like how many days would you have for the exam. So that's like you're measuring, counting something, right? So achievable is ensure the goal is realistic for the child's age and development stage, yet still provides a healthy challenge. So achievable is the achieving something, right? A milestone for you, right? Achieve a milestone, right? Relevant is the goal must be meaningful to the child's daily life, interest, and overall curriculum outcomes. Relevant is something like relevant. Do you know what relevant? Yeah, we can say it. It should be like meaningful and it should be matched. So time bounding set a clear deadline or observation period to review progress. Like for example, over the next 2 weeks. Time bound is like you're like thinking, I have 2 weeks, I have 3 weeks for this, I have 4 weeks for this. Like, example goals. Social emotional. The child will verbally express their emotions or use role play instead of acting out during pre-structured activities per week over the next month. Smart independent living. The child will be able to complete unassisted hand motion before snack time by following the visual steps consistently for 2 weeks. Cognitive and language. During daily circle time, the child will practice identifying at least 3 shapes by tracing them in the air for the next 4 weeks. So these are some like when it comes to social emotional and when it comes to cognitive and when it comes to like independent. Setting objectives. So do you know what objectives? What is objectives?
Like ambitions.
Amina can't hear.
Like ambition, like
Is absent. Is absent. Naslia.
like purpose,
Isra. Jessica. And Objectives should explain what will be achieved, who will benefit, when it will happen, how success will be measured. So from Tamil, we used to say "nokam," our "nokam," like that. From "nokam," some aim you have. Aim. You can say it like ambition. So planning activities, for example, nutrition education, cooking demonstrations, exercise sessions, growing monitoring, and health screening. Resources needed, budget, staff, equipment, educational materials, and community partnerships. Budget in the sense money budget. Role of stakeholders. Stakeholders include parents, teachers, healthcare professionals, community leaders, and government organizations. Changes in program design, limited funding, poor participation, lack of awareness, cultural barriers. So if you can change the nutrition program into another nutrition program, if you are having like limited funding or like poor participation, those kinds of facts. Monitoring in ECC. Monitoring in early childhood education is the ongoing observation and documentation of a child's progress. It involves tracking everyday learning, social interactions, and developmental milestones. Educators use this continuous data to tailor instruction, celebrate growth, and identify children who may need extra support. So monitoring in agency is known as like observing. You observe about children, right? About their physical health, mental health, social health, and about the language, about the development delays they have, about monitoring all of this, right? Key focus areas. Developmental monitoring. Observing how a child plays, learns, speaks, and moves to ensure they are meeting typical milestones. You know about milestones, right? Kid milestones. Can you remember? What are milestones? No, those are like Jane Piaget stages. So I'm asking about the meaning of milestones. Yeah. So when it comes to like language milestone, from 0 to 1 years, they communicate with laughing, sorry, crying. So when it comes to no, before that, before that. Yeah. Maybe not in this section. They are okay. We wrote in this section. So it's the section of previous one, no? Zero to something feeding something weapon. That's what theories. No. No. That are the phallic anal oral, those, not those stages. That is the milestones. What? Mm. Mm. Those are like oral anal phallic latency, not that one. That's what is included, but these are not key milestones. Key milestones is different. Same, but this one only comes for segment rates. That is different. You are search and tell me. Okay, so I'll continue this. Progress monitoring, tracking performance on specific educational goals like motor skills, vocabulary, and problem solving to refine teaching strategies. Behavioral and social monitoring, noting how children interact with peers, process emotions, and adapt to classroom routines. I mean, it's good if you like have a small note of regarding like what today's lecture is on and what is the previous lecture is based on, like any topic, so that you can remember on this lecture we have studied this, on these lectures. So in that you don't have, and that's what I mean. So why monitoring is important? Monitoring helps track progress, identify problems early, improve implementation, and ensure goals are being achieved. So common methods and tools. Educators and caregivers are use various methods to monitor children without interactive play. Observations and anecdotal notes, writing short objective description of what child does or says. Work samples and portfolios, collecting drawings, writing attempts, and complete activities over time. Checklists and rating scales, using age-appropriate charts to mark master skills. So by monitoring, you can ask like, you can give, as educators, you can give those kinds of common methods and tools to the parents. Now this is developmental monitoring, right? So developmental monitoring is observing how a child grows and change over time to see whether they are reaching developmental milestones in how they learn, play, speak, act, and move at each age. Parents, grandparents, early childhood providers, and other caregivers can participate in developmental monitoring. So developmental monitoring is observing like how a child will grow and change over time, right? So are they reaching the developmental milestone at the specific age? That is developmental monitoring, right? So when you take your child to the doctor for each well-child visit, talking about child development is important. Your child's healthcare provider will ask questions about their developmental while interacting with your child to see if they are meeting milestones that most children their age can do. A missed milestone could be a sign of a developmental delay, right? If your child is missing a milestone, or if either of you have concerns about how they are developing, the doctor may do a developmental screening test as the next step. By asking questions and sharing any concerns you might have with your child's doctor, you can understand how your child is doing and learn ways to support your child's development. So for every child visits, from being a mother, from every child visits, you have to tell your concerns to the doctor. Like every small concerns to your doctor. So a missed milestone can be a developmental delay, right? So you have to know that they are achieving these kinds of milestones at a specific age of their life, right? So you have to share those developmental milestones with Dr. Hassan. That is known as the developmental monitoring. Developmental screening. This is like I said you before. If in here, see, if your child is missing a milestone, or if either of you have concerns about how they are developing, the doctor may do a developmental screening test at the next step. So if your child is missing a milestone, or if you feel like there is something wrong with my child, you can speak with the doctor, and the doctor will do a developmental screen test as the next step, right? So developmental screening takes a look closer of how your child is developing. The tool used for developmental screen are formal questionnaires or checklists based on research that ask questions about child development, including language, movement, thinking, behavior, and emotions. Development screening can be done by your child's healthcare provider and by other professionals in healthcare, early childhood education, community, or school settings who have been trained in using these tools. Yeah, yeah. Questionnaires, survey, like that. It's not like something like using technology or like something. No. Or like it's not like a scan or something. It's like basically about a questionnaire. Questionnaire. They used to like ask questions, or they will give you a form to fill out. So you can take help from the early childhood providers or any healthcare providers, like so about a child's developmental week. So developmental screening. The American Academy of Pediatrics recommends developmental screening for all children during regular well-child visits at least at these ages: 9 months, 18 months, 30 months. In addition, American Academy of Pediatrics recommends that all children be strict, especially for autism, during regular well-child visits at 18 months, 24 months. If your child misses one of these well-child visits, or a screening was not done at those moments, it should be completed at the next visit. Your child your child should also receive a screening at other times if you or your child's doctor have a concern about their development. So it's good if you talk about your concerns and about those developmental screening tests with your doctor and get it done with this kinds of months: 9 months, 18, and 30, up to 30, right? My advice is like don't skip that. Even if your child has achieved the milestone at the specific age, don't miss it. Don't miss those developmental screening tests. It's just about a questionnaire, right? It's like it almost take about like 20 to 25 minutes actually. So don't like miss it. So this is the difference between this is development monitoring and this is developmental screening, right? So when it comes to developmental monitoring, who in the sense everyone, families, other caregivers, and anyone working with young children. So yeah. What? Look for developmental milestones. When early childhood, especially from birth to 5 years. Why you are taking this development monitoring is to help celebrate a child's development, talk about child's progress with doctors, childcare providers, teachers, and other professionals, learn what to expect next, and identify any concerns early. So, how in the sense with easy to use free checklist, get yours at this one. You can visit this link, and you can see those kinds of tests or screenings. For an example, you can look at it. Right. So this is development monitoring, and this is developmental screening. Healthcare and early childhood professionals train in screening. So what? What is the reason? Look for the developmental milestones. And when development screening at 9, 18, and 30 months of age. If you want to like autism screening at 18 or 24 months of age. Additional screening can done for concerns. Why? To find out if a child needs more support. It is not always easy to know whether a child needs help with development. If further evaluation is recommended, how in the sense with a formal validated developmental screening tool. In the sense, surveys, questionnaires like so. If you if you ever like imagining or if you like you're expecting in the sense if you have any concerns that this my child would be an autism child, you can get test at 18 to 24 months of age. And you can make sure my child is very healthy. Right? So any doubts on development monitoring and screening? So monitoring is basically like observing about development delay, right? Screening is about like you have to talk to the doctor about the concerns and everything, and you have to understand, and you have to take those screening tests at the specific age. Clear? So developmental monitoring is about observing about the developmental milestones. And developing screening is developing screening is whether you talk with the doctor about concerns and about the child developmental milestones. And after that, you can write this one. Developmental screening, this one, and autism screening, this both. Yeah. This both are like based on developmental delays to figure out developmental delays. Actually, you can do this developmental monitoring and developmental screening as a program as well. If you're willing to do in a child care facility, you can actually conduct that. So developmental screening you can take because you can conduct questionnaires from the mothers and fathers, and you can tell what are the developmental delays and what are the developmental milestones they didn't achieve. You can conduct a program as well. Done? There is more actually. Are you like taking a break and come back? Great. Okay, we'll finish this slide. So why development monitoring and developing? Huh? Yeah, 10 more slides is there. Finish. It's okay, you go for interval then. Wait, I'll complete. So identify development delays and disabilities, early help children and families. Development monitoring and screening work together to help identify developmental concerns so that children and families can get the service and support they need as soon as possible. Right? So early development intervention services support the child, helping them at home, school, and in the community. Development disabilities are common. In the United States, about 1 in 6 children aged 3 to 17 years have one or the more development disabilities such as autism or attention deficit hyperactive disorder ADHD. Right? So of course, developmental monitoring and developmental screening is important to recognize the developmental delays at the earliest convention. Right? So yeah, so in the United States, about 1 in 6 children aged around like 3 to 17 years has one of these developmental abilities like autism, ADHD, cerebral palsy, those kinds of things. If you are able to like take within 1 year about those developmental screening tests, it is good. So you can know that my child has autism and I want to cure it. Like apart from going like about not knowing about the specific disability of your child has, the more you have to know about the specific disabilities your child has is good, right? So you can cure it quickly and you can get it done. Apart from like if you don't know about what is the disabilities your child is having, it is of course a risk for your child. Because after going around like 4 or 5 years for them, the autism risk can't be cured. If you can recognize that in and below a year, it can be cured. Right? So the developmental monitoring and developmental screening is way more important for your child. Right? And for educating others as well with those kinds of programs you can take on, so it's good only for like others, you are helping it. Right? So yeah, is there any doubt up to now? Clear or like confused? Okay, you can take the break and come back at 12. 12. Online students, can you hear me?
Yes, ma'am.
I'm sorry to starting this late. These physical students didn't care. We
Uh,
so yeah, it's good. Childhood obesity. Why? Oh, that's it. That's okay. Then so you better stay at home and join online. Huh? What? Go. So key performance indicators, which is like KPIs, right? Key performance indicators in early childhood education measure both pedagogical success and operational sustainability. So what is like pedagogical and pedagogical? Pedagogical is andragogy, adult centered. So pedagogy is child centered. Andragogy is adult centered. Is it clear? Yeah. So critical educational KPIs track developmental milestone progress, daily attendance, and child to staff ratios to ensure high quality individualized care. Okay, so key performance indicators in the sense KPI tracks developmental milestone programs and daily attendance of children and child to staff ratio, right? So in here, if you see the picture, oops. If you see the picture, so KPI includes about the objectives and about the performance, which is like daily attendance and all, right? And the evaluation same as the daily attendance, and the measurement, success, and the strategy, which you are using in a child center. These are KPI indicators. Sorry, KP indicators. Clear? So, example, attendance rates, participation, knowledge improvement, behavior changes, and health outcomes. You can use this as a chart. KPI indicators, right? Has charts, you can use it. Sorry, not charts, like tables. Forms, questionnaires, you can use it. Key Easy E KPI divided into 4 core components. The first one is child development and educational quality. Milestone achievement tracking progress in age appropriate cognitive, motor, social, and emotional development. So tracking the age appropriate milestones, right? Teacher child interaction quality. Evaluating meaningful, responsive interactions, typically measured using frameworks like classroom assessment scoring system. Student attendance rate, monitoring daily presence and engagement patterns to identify potential early learning barriers or safety issues. So this is the first core components of KPI, right? And the second core component is operational and health safety, which is the first one is staff to child ratios. Maintaining strict adherence to regulatory compliance or safety standards. Incident accident rate. Tracking the frequency of injuries or illnesses to evaluate the effectiveness of your center's health and safety practices. Staff professional development hours. Measuring ongoing training to ensure educators are utilizing up-to-date NAEYC aligned pedagogical strategies. So this is the second core component. Why? Why? Confused? Then? So the third one is parent satisfaction and engagement. Net Promoter Score, which is NPS or satisfaction. Gauging family happiness regarding communication, curriculum, and the overall experience through regular service. Parent involvement. Tracking participation rates in center events, workshops, or parent-teacher conference. The fourth one is financial and business sustainability, occupancy and enrollment rate, measuring the percentage of open seats filled and enrollment rate about 85 to 90% is typically the benchmark for financial health. Staff turnover rate, keeping annual educator attrition below 15 to 20% to provide consistent, stable care for young children. Revenue per child and profit margin, monitoring financial metrics to ensure the center can invest in high quality materials and staff retention. So the first one is about the child development milestone, whether they are achieving the child development milestone at a specific age, right? So that is child development and educational quality, right? So the second one is, this is about the staff to child ratios. Like if you are able to take care of one child, so for one child, one teacher must be there, right? So that is around like staff ratios. So for one child, another, so for one child, one teacher must be there, right? So at the same cases, for three childs, two teachers must be there. This is known as staff to child ratios. One to one is if a student is one student is there, one educator must be there. This can be an infant like that. For toddlers, of course, if 3 toddlers are there, there should be assigned 2 educators at least minimum. Because we don't know whether the staff is like equally to the students. Staff to child ratios. So we doesn't know even if there are 10 students in the child care center, we don't know whether we can take up to 10 staff, right? So apart from if there are 10 staff and if there are about 20 toddlers there in the child care center, so we can arrange that to 2 into 1, right? 2 toddlers in 1. So 2 into like 10 1 into 20, 2, 20. Like that. This is like staff to child ratios. Right? So operational and health safety is more about a child to staff ratios. And parent satisfaction and engagement. Just give me a minute. Okay. So parent satisfaction and engagement, in a sense, you can tell parent or you can educate parent, giving them the proper knowledge about their children. Like their children did this to them, did this today, this one completed this today. Like telling those positive feedback helps to their parents. Right? So financial and business sustainability, in the sense it's more about the financial things. Right? But whether you can give the salaries properly and they are like promising. So that's about that. Money, yeah. How they are like about to invest. Whether they can give those salaries to up to date, those are like that. Data collection method. So this was there at the beginning, right? Yeah. Okay. Data collection method: surveys, questionnaires, interviews, observation, health records, and focus groups. So importance of accurate data: measure progress, improve decision making, identify strengths, identify weakness. For an example, marking daily registers. So you know about the measure progress, about the student progress, whether the student is like continuously coming or like breaking up with like absentees, like, like those. So improve in this. What? So you can identify the strengths and weakness as well, right? Go. Accurate in the sense that is like accurate. Accurate in the sense very accurate, like very true, we can say. It's very true. Shalini, for accurate, what we tell in Sinhala? Hariyatama. Ilakkatama. Not like a target, not like exactly like, yeah. Accurate. So program evaluation methods: pre and post steps, feedback forms, observation, health measurements, attendance records. Feedbacks: sources of feedbacks: participants, parents, staff, community members. So if you are giving a feedback, you can only give this to people, right? So improving programs based on evaluation: modify activities, increase resources, improve communication, provide additional training. And role of health professionals: they help by conducting assessments, providing education, collecting data, evaluating outcomes. Ethical considerations: confidentiality, informed consent, respect for participants, accurate reporting. So you know about ethical considerations, right? Rules and regulations of the childcare facility. If you are working on the childcare facilities, you should follow the rules and regulations. Yeah. Wait. I'll explain. Importance of accurate data. So accurate data in this is the exact data, right? So measure progress, improve decision making, identify strength, identify weakness. So for an example, having a daily register, the exact data on it, like continuously, you can measure the progress of one student, right? when he or she is continuously present, or when she or he is continuously absent. You can measure the progress by looking at it, right? And improve decision making. You can get a decision to inform her parents or the guardian or something, right? So you can identify the strength. If, for an example, if he or she is continuously present, you know the strength behind it, right? So if he or she is continuously absent, getting absent one day by one day, you can identify the weakness. You can ask, why are you like this? What happens? Why are you getting absent? Like those kinds of weaknesses. Okay. Any doubts? Online students, any doubts?
No, ma'am. No, ma'am.
Okay, now you can go ahead with the activity one. Good. Yeah. So in here, let me explain. So in here, activity 2, you have to design a health promotion program. Okay. So just assume that you are working at a childcare center where many children refuse to eat vegetables. Right? Design a health promotion program. Include target group, main problem, goal, 2 objectives, 3 activities, expected outcomes. I did IT. I did IT.